The news of 9 new COVID cases came with a message of caution.
A day of single-digit numbers is not a trend, and I wouldn't be surprised if we have double-digit again tomorrow.
Plus, confirmation the lockdown won't be ending early.
The lockdown will not be ending before the 2nd of September.
The outbreak has now grown to 176 cases. Of the 9 new infections, 8 can be linked, and 3 were in quarantine for their entire infectious period.
7 people are now hospitalised and 1 person remains in intensive care in critical condition.
The number of sites where transmission has occurred has jumped to 10. The CIT campus in Reid has joined the list, with 2 linked cases. The Bright Bees cluster has also seen a spike from 3 cases yesterday to 10 today. And it's both children and adults who are infected with COVID-19.
What I can say is that we're not seeing any severe disease among children up to this date, and that has been the national picture.
The cluster in the disability sector has also climbed to 15, with another person living with disability testing positive.
I urge people in our community who are living with disability who have questions or concerns to discuss these with their service providers, and/or they can call the COVID-19 helpline.
Each day at the podium, the Chief Minister has delivered the same message: to get vaccinated. And Canberrans have certainly been doing as they're told, with a record number of doses administered yesterday.
Around 2,700 doses issued in ACT government clinics and around 2,000 through GPs and pharmacists.
That's despite the health workforce being short around 650 staff, who are all stuck in quarantine. To help fill that gap, student nurses and midwives were today tasked with joining the vaccination effort.
The health sector is under so much pressure in all parts of the country, so to be able to do our bit means the world.
It was this finger-pointing from the New South Wales Deputy Premier about COVID fragments in the sewage at Merimbula that caused a stink.
We are concerned because of the proximity to Canberra, knowing that many Canberrans had moved down to the south coast. We have no known cases. It's been an area that's been quite clean from COVID for a very, very long time.
Does John know something about the poo that other people don't? I don't know where he's getting that from. I mean, if he's got scientific evidence that can back it up, that it's Canberra poo, OK, all right. But, I mean, seriously.
Tomorrow marks 14 days since the lockdown began, and while it might not be ending early, there may be a slight easing of restrictions for week 3. The Chief Minister says some changes to the current health directions are being considered and will be announced ahead of the weekend. Rosie King, ABC News, Canberra.